Please join me in welcoming Winselow Tucker, President and General Manager, Eli Lilly and Company, India, and Dr. Chandrakant Lahariya, Public Health Policy Strategist. May I also invite Sonal to once again take this conversation forward.
All right, almost good afternoon there, and we are back this time with another fascinating chat. I think if there's one thing that connects us all in this room, no matter your age, no matter your gender, no matter your nationality, is our health. And it is so important to sort of address that at the Rising Bharat Summit here, where we're talking about youthful aspirations. I'm so thrilled to have our panelists here with us on stage who've taken out the time to discuss about this topic, which a lot of people are talking about, but very few know about. There is a lot of information, not so much that is true. So over the next few minutes, the idea is to decode the science behind weight loss drugs. The idea is also to understand who is it for. And the idea is also to get a better grip on how to approach this as a society, as a nation. So let me take the first question to Dr. Lahariya then. Dr. Lahariya, we are the obesity capital in so many ways. Our numbers are almost there in the top 3. At this time, when weight loss drugs should in a way be, like if it were any other disease, it would be celebrated, that finally there is a cure. Why is it that we are looking at these drugs as you're not sure what is it for or what's happening? So can you begin by first defining what have we understood wrong about obesity in general?
Thank you very much. So one of the important development in last decade has been, last decade and more so in the last few years, has been that we have started recognizing obesity is a health issue, a health condition or disease which require treatment, care, management. And these are important conversations because if we go by the numbers, in 1 in every 4 adults in India is either overweight or obese. And there are other ways to look at it. For example, if we talk about generalized obesity, that is 1 in every 4 adults, but abdominal obesity, which is an important risk factor and parameter to measure obesity, is 1 in every 3rd adult. And another approach to look at it, which has implications in terms of heart disease and other, is dyslipidemia. So the level of cholesterol and lipids are deranged in 1 in every 5 adults. So these numbers are worrying, and they all come from extra fat in the body. So first point, if we talk about the important part is that we have lately started recognizing that obesity is something which requires care.
But if Dr. Lahariya, you could tell us the difference between being fat and being obese.
Well, that's a very interesting point, and that's why I gave a longish introduction. So the point is that there are a range of definitions for obesity, and for long, the approach which was used as a body mass index. So WHO said that more than 25 is overweight, more than 30 of body mass index is obesity. But over a period of time, this definition has changed, and they are contextual also. For example, Asian Indians, there is a concept called thin fat Indian, which means for the same body mass level as of European, Indians and Asian population has a higher body fat. And the composition of body fat is a major factor. So the definition keeps changing. For India, the definition was always lower, BMI. But more recently, some of the Indian definition has come, which say that anyone who has a body mass index more than 23 is obese, which is stage 1 or stage 2 obesity. That definition has come. But I want to delve briefly into this. So there are new other parameters to look at obesity. For example, your waist circumference. For the male, it should not be more than 90 centimeter. For female, it should not be more than 80 centimeter. There are other approach to waist circumference to height ratio. The waist circumference in the centimeter, if you divide height in centimeters, should be less than 0.5. So multiple parameters are coming up, and now globally there is a discourse going on that it should be preclinical and clinical obesity. But finally, coming to the key part, I am really pleasantly happy as a medical doctor and public policy specialist that the societal norm which normalize obesity as just a well-fed individual is changing. We people have started, people across India and policy making have started recognizing that obesity or overweight is a health condition, which is a risk factor in itself, but also a disease condition. And final point I would like to make is that this discourse is really important because that's where we can start making difference.
I'm glad you brought it up because I think we are finally at that stage where the education or perhaps the definition is becoming more nuanced. Is no longer somebody just looking a particular type fit. Being lean does not mean being fit. Similarly, being fat does not mean that you are so-called unfit. But a lot of people struggle with other issues as well. I'll come to that in a bit. Let me bring in Mr. Tucker there. Then, when it comes to weight loss drugs, I think the most pertinent issue is that people see it as a magic pill. What is it that they are missing here?
So I think first it's important to note that it's not a magic pill, right? It's also not for lifestyle. It's not for a vanity tool. These are medications that are approved for use with a prescription, and therefore a chronic disease, which is obesity, right? We had a definition of obesity, and I think it's important to note that when someone is overweight or obese, their body is set a new level of weight. We call that like a set point. And so the body wants to maintain that set point. And when we think about these medications, they operate on two different levels, right? They target incretin hormones, and there are two, GLP-1 and GIP. And so they either target those individually or both at the same time. And what they do is they work on a brain level to regulate appetite, regulate hormones, regulate metabolism. And so over time, the body then perceives hunger differently, food intake differently, which allows patients to lose weight. But importantly, over time, it also resets that weight set point so that the body's not working against the patient and that they can actually maintain long-term weight reduction. Now, it's also important to note that they also impact glucose control, which is sometimes dysregulated in patients who have obesity. And so there are metabolic benefits as well that go beyond just weight loss. And so, once again, they are prescription products that work best when they are used with lifestyle changes as well as under medical supervision, and they need to be tailored for the individual patient. But once again, not a magic pill, but part of a comprehensive weight management program.
A comprehensive weight management program. Dr. Lahariya, then I want to understand from you, then who is it for? The question I think in the audience is going to be, can everybody take it? Can only diabetics take it? How does it work?
Well, I would go overall holistic approach for weight management. And let's understand, let's put some human face to it. That while we keep talking about overweight and obesity in adults, but if we go by the numbers, when it comes to children, India has one of the fastest rising burden of obesity in children, one of the fastest in the means top 3 countries are the Namibia and Vietnam are other 2, and this has increased rapidly. But let's put a human face to it. I often engage with some of the senior medical doctors as a researcher. And I was hearing one of the senior doctors who said that 3 decades ago when they were trying to conduct a survey in school children, it was very difficult to find overweight and obese children 3 decades ago. So they were wondering whether they would be able to complete the study. And now in these times, if someone wishes to do study in school children, you find many school children who are unhealthy. I work closely with certain number of schools, and I was talking to some principals, and they said that these days parents send such an unhealthy food or other things in the school tiffin for the kids, which is resulting in this rising obesity. I know that there is one of the discussion panel in this session was about screen time and exposure to social media, and all of this is bringing reduced physical activity in kids. The play time is reduced. So essentially, these narration indicate that if we want to take control of obesity, we need to follow a holistic approach. This requires 3-pronged approach minimum. And this is what I tell for all the lifestyle diseases, all the health conditions, not just obesity. Any condition, health condition which is lifestyle originated has 3 treatment or interventions. One is increased physical activity. Second is a dietary modification. And third is medication. Even if a medication is available, that is not the solution unless we pay attention on the first 2. And these 3 points are important because if the moment we start thinking of any available medication, which is important because if science is there, research is there, we need to keep developing newer intervention and medications to ensure that people who are not getting benefit from the first 2 will benefit from it. But all 3 together makes an good care. And Sonalji, that's where I want to highlight that we often keep focusing on treatment, which is important part. Medical advance should benefit everyone, but we should also keep looking at holistically. Increase physical activity, improve dietary pattern, and then available medication for all the patients. This final point here is that this essentially makes that often people argue that obesity is an individual issue. They believe that, okay, if someone is overweight, obese, it's their fault. I believe that this is a societal issue because there is a higher economic burden of obesity. If as a society people are overweight or obese, that has an economic cost in the terms of healthcare. It has a cost in the reduced workforce capacity in the terms of sick time or absence from the work. And there are estimates available in 2019, this World Obesity Federation data. In 2019, around 1% of India's GDP was equivalent was loss on the obesity-related challenges, absence from work. So it is worthwhile to invest in every intervention, including medication, increasing physical activity, dietary intervention. This will help economic growth, and this will help in any country becoming a developing or prosperous nation. Yeah. So obesity has multiple dimensions, and I can keep talking about these.
Yeah, we let you. That's the whole point of this discussion. But I'm so glad you brought that up. Because I think, and Mr. Tucker, if you can take that question. In a society where physical transformation has to be more led by work and hard work, and natural transformation is glorified so much, what role and what larger role are weight loss drugs then, sort of playing there?
So one thing that I want to start with is saying is that, I'm actually very happy that we're having this conversation and that obesity is starting to get the attention that it deserves in India, right? We want to provide gratitude to the Prime Minister and also to media for raising this because it's a critically important issue. Now, weight loss drugs overall are part, as you said, of that overall management. And I think that we have to change the narrative around weight loss if we really want to address it. You're right, it is around not just lifestyle, it's around lifestyle and a comprehensive approach. But we also have to recognize that there is a bit of a stigma on weight loss, and that patients who have obesity or who are living with overweight every day are addressing this stigma. And until we start to change that, we're not going to actually have patients or individuals who are living with obesity actually seeking some of these treatments. Now, where I think that these medicines can change that is it's starting to change the view of how we think about obesity. It's not just about blame, it's really about biology, right? We know that there's a different way you need to address this, and I think that's critically important. I think also that, as you talked about, we have to be really cognizant that this is part of that comprehensive approach, and that if we do that over time, we'll start to see patients come forward and feel more comfortable in seeking treatment.
I'm very glad you brought that up, because the follow-up to that, Mr. Tucker, is that what is the biology of obesity? Yeah. I think the needle needs to shift on not just what is weight loss, but first we need to be very clear on what is obesity. And how do we tackle that? So what is the biology there?
So I'm not the medical expert, so I'm not going to talk about the biology specifically. What I can tell you of how these medicines actually impact that biology, okay? So as I started to talk about earlier, we know that a lot of things change when a patient is obese, right? How they perceive their satiety, how they perceive their appetite. Their body is working against them, so they continue to increase. What these products do is they act both on the mental side, so they change how you perceive being full, they change how you perceive that your appetite, and so that reduces. It also works on the level of slowing their gastric emptying as well. So what that means is you feel full sooner and for longer, and so therefore your appetite changes as well, right? The last point, which I think is really important, is that it kind of changes that set point. I keep talking about the set point because your body's working against you. After you lose weight, your body wants to gain weight. This helps your body to kind of be at that next level where you can continue over time. And we have to recognize, to your point, that's why it's so important, that it's part of this comprehensive piece, because you have to have lifestyle changes and along with the medicine to have the best outcome. Last thing I will say is this one thing about this, which I think is really important. We talked a lot about obesity, and you were saying, like, how is it different? I think we want to change the conversation from just obesity to better health, right? Because ultimately, these products will help patients to not progress to some of those long-term complications like diabetes, cardiovascular disease, dyslipidemia, that really impact their overall health and cost to the system. And so I think if we start to change that stigma, we can actually have a broader
I think that's
impact.
very important, and I'm glad you brought it up. But just to expand on that, and if Dr. Lahariya can also come in on this biology of obesity and how it works here, because a lot of people still feel that, oh, just take these injections and that's it. That's all you got to do. I don't need to hit the gym. I don't need to put in that extra hours. It'll control my appetite, and that's that. Can you sort of drop some truth bombs there?
See, across the world, and most of the guidelines from Endocrinology Society, other society, categorically say that a first line of management is a dietary modification and lifestyle changes, increased physical activity. And one of the component in that is anti-obesity medication. So these are definitely entire gamut of things, but not the first line. That's part one. Second part is that these are prescription-only medicines which are provided by a medical doctor based upon individual case-to-case discussion with the patient. There are standard laid-down approaches and guidelines that who is the right person for getting these medications. So my suggestion would be, please, anyone thinking of these medications, consult your physician or provider. This is not something, I know it's available for some people without prescription, but this is not what should be done. It should be prescription-only approach that should be followed. Going back to your previous question, and often people complain that, oh, we have tried increasing physical activity or dietary modification, it is not working. Shall we go for it? Possibly yes, but consult a physician. That will be my advice. Part of this, I would like to briefly reflect about biology of it. So as we know that our body has essential roles of hunger and satiety. There are hormones which are released from intestine or your brain when you are hungry, and then once you start eating, there are hormones which are released from intestine which send the message that your satiety status has reached. But what has happened, and some of this is genetic and biological, but what has happened in today's lifestyle, when you eat very fast, so there is not enough time in your intestine and brain to register that message that you have eaten this much, and then you keep eating. So changing in the lifestyle is one of the factors. Of course, there are people, for example, I would say that there are people who have tried all of these things. There are some excess weight, like BMI, certain BMI threshold which is crossed. For them, if a prescriber suggests, and these are the medications which can wonder, and we know that we now have medications which can reduce 15 to 20% of the weight over a period of 3 to 6 months. But I'm again warning that this is something, a doctor-based, prescription-based approach which need to be followed. And even if you are being prescribed medications, there is definitely a role of lifestyle modification, physical activity, and other aspects.
But let's look at the other side of the spectrum then. And I want to understand the struggle. So many people I know today are struggling to shed weight. So many people I know today are trying everything. They lose weight, but then it comes back. How should they be approaching this? Dr. Lahariya, to you first.
This would be, again, an individual one-to-one question, but often...
I say this, you know why? Just to sort of build in a context here. Because we as a society shame people who don't look a particular way. We as a society want that perfect Instagram filtered face and body. So how are we to approach that problem?
So I'm going to talk about some certain approaches to, for example, when we talk about a medical provider about improving dietary habits. Essentially for me, when I talk to my patients, I say that diet has a three component. One is a quantity. If you are overweight, obese, definitely you are taking more calorie than you need. So reduce the quantity of that meal. That's the part one of the meal, and that's often people discuss. But then second component of that is a quality of the meal. If you are taking high sugars, packaged food, ultra-processed food, that's a problematic. And if you have extra oil and fat, that is problematic. So you need to alter quality of the meal, which essentially means reduce fat, reduce carbohydrate, and increase protein. So first part was reduce quantity. Second is improve quality of a meal. Third is the sequencing of meal also, the way you eat, how quickly and how slowly you eat. So I just give you an example of that, how the same meal or same approach which they are following, but bringing the nuance to it. Another approach to it is, for example, there are many patients who are overweight and obese. Definitely, in very likelihood, they would have a fatty liver. Now, what people do not understand that why fat is a problem. I tell them, and this is the unscientific reason, that anything which should not be somewhere, if it's there, it is problematic. So when your body has extra fat, it gets deposited in liver, viscera, other organs, other places. And since it should not be, for example, it should not be in the liver, and it is a fat there, then your liver starts recognize that's a foreign antigen. So it starts inflammation. And inflammation means your immune system gets activated, your antibodies start forming, and this results in damage to that organ. So obesity or overweight is an inflammatory condition which activates immune system, which makes you prone to multiple diseases. And that's why one of the recent Lancet paper on endocrinology and metabolism had talked about that obesity or overweight can essentially affect all the organs. But I bring you a good part of this thing. Whatever mechanism you follow, anti-obesity medication, physical activity, lifestyle, or dietary modification, if anyone, no matter what is the weight of that person, if that person can reduce 7 to 10%, let's not go to 10%. If 7% weight reduction, the first place where fat is deposited, liver, first place from where the fat will disappear is liver. And you will control many other conditions. In this round, I would say, please, once you go back, you read a common soil hypothesis. There is a scientific hypothesis which says that obesity results in not many conditions, but it is a soil for a diabetes. Because if you have extra fat in your body, especially liver, the insulin which is produced in your body will not be able to reach to liver cells and muscle cells, and then insulin resistance will develop. You will develop diabetes. So obesity is a harbinger of many health conditions. Diabetes is one of those.
Yeah. So we've established that obesity is a chronic problem. We've established also perhaps that weight loss drugs, however, seem to be in this blanket of secrecy. There is still a very strong stigma attached to it. It's perhaps changing in the West. In India, the narrative is still different. Mr. Tucker, why do you think that is? And what can organizations like Eli Lilly do to move the needle on this conversation and this narrative?
I think that's a great point. I think that first, to my point before, first let's address the stigma of obesity itself, because I think that is keeping for patients from actually seeking treatment. And as you said, this has to be a comprehensive approach. Diet, exercise, and also weight loss medications can be part of that. So I think that's the first thing. First, let's address that. And in addressing it, we have to be really cognizant that, obesity today is viewed as a personal responsibility or a lack of personal responsibility, right? That diet, exercise alone might treat that, which For some, it may, but there is also
People think you're fat because you're lazy.
Correct, which is totally wrong. And then if you get past that and you start to say, can we make it safe for people to explore treatment? Because many people are embarrassed to talk about obesity, and so they don't even explore what the treatment options out there. Once we start doing that, then we can start to talk about where do weight loss medicines fit in, right? My hope is that as we start to look at where weight loss medicines fit in as a prescription drug with physician supervision, that more patients will feel free to get these products. We will see the impact of these products. We know that over time, many patients who have taken these products have gotten to a weight level and been able to maintain that. There are obviously side effects that we have to be cognizant of, but that will allow people to figure out where these can fit in and how they can help impact overall health of patients as well.
Right. So as we come towards the end of this session, I also want to address some misconceptions.
Sure.
And I'll go to Dr. Lahariya first and Mr. Tucker right after. Dr. Lahariya, what are some of the misconceptions, if you were to state? You can give me your top 3 on weight loss drugs.
What is the misconception of weight loss drug?
Yeah.
I think one of the misconceptions is that weight loss drugs are magic remedies. As already said, that they are one of the tools available in hand. And they are important tools which we should use as per medical prescription, but they are not magic remedy. That's one. Second thing is that people often believe that there is nothing which they can do about the weight. They were always like this. Of course, they can follow a certain lifestyle and certain medical advice, and that can help in improving. Third and most important misconception is that this is individual responsibility. I think it's an individual, family, community, society, and government responsibility. Everyone need to play a role in this approach. For example, if someone advised that you do physical activity, but that requires school should have a playground, that requires city should have a space for bike ride and other things. So it requires intervention on multiple levels. I think I've done 3.
Yeah. Your top 3.
I think the first one would be that there's a myth that weight loss is due to not would say personal responsibility as much. Yes, personal responsibility, but also it's a choice, right? That you choose to be obese. And I think that's totally incorrect, right? We know that. I think there's another one that everyone loses weight the same way. We know that's not true. It's an individual response, and therefore it has to be tailored to them individually. The last misconception, I think, is a big one, which is that obesity is not a disease. But in reality, we know that globally it is recognized as a disease that is progressive, relapsing, and needs a comprehensive approach, of which medical treatment can be a significant part.
Right. Last comments then, and Mr. Tucker, I'll begin with you. What is your hope then with weight loss drugs in the Indian context on what they can do for the medical fraternity on the whole and this entire, on the medical infrastructure on the whole?
I think as I think about India and this vision of a healthy India, I think that these weight loss drugs hopefully change the conversation around just obesity and weight more to health and how we can improve health so that individuals can achieve their best level of health. And I think that is a comprehensive approach. It is addressing the fundamental cause of obesity, which these drugs go to, the hormonal cause, the metabolic pieces that drive the disease, and not just the symptoms. And that we make it safe for people to talk about obesity and seek treatment, particularly with lifestyle changes, medical intervention as well, so that patients can achieve their highest level of health, and we can improve society and also reduce health costs.
That's quite lovely. Dr. Lahariya, then, I was going to ask you the same question, but with a different lens. We are looking at India, which is very aware now. This generation is talking about health more than ever. We also have the government coming out with initiatives which are taking and putting health at the forefront. You've got the Fit India movement. The Prime Minister talked about it in his Mann Ki Baat as well. So we seem to be moving in the right direction, or so it seems, when it comes to this entire conversation on staying fit. But what is the roadblock? What do you see as something holding us back? What I'm essentially asking you is, if the Prime Minister was listening to you right now, what would you tell him to do that can unlock the potential of how much we have developed both in the mindset and medical science on fitness?
Let me answer this in two parts. One is what we are talking about, weight loss drugs or anti-obesity medications are essentially anti-diabetes and also have a multi-organ benefits in terms of kidney health, liver health, heart health. So they are really useful medication, and that it boils down to that if you reduce weight, no matter whether by physical activity, dietary modification or anti-obesity medication, it is going to work in multiple ways, keeping you fit. Second part on what are the roadblocks. I would flip the question. I would say there are 7 P's approach which we can do. One is that we need to focus upon preventive aspect of health. Second is we need to bring attention on promotive health. Third is prompt treatment. If you are required treatment, you go for a prompt treatment. Fourth is a policy approach. We need to have that kind of policies which support all these interventions. Fifth is everything should be done as per the need of people, people centricity in this approach. Sixth is programmatic intervention, which essentially means just do not focus upon one isolated intervention, but make it a holistic programmatic. And seventh is a partnership between public and private sector for a public purpose. So we need, if we do 7 P's, prevent, promote, prompt treatment, policy research, people centricity, programmatic approach and partnership, it will take care of a holistic approach on our different components. Otherwise, simply focusing on medication or increasing physical activity or reducing oil is not going to work. We need to give it a shape of that where all the components are taken care of.
I think that's very well said. Thank you both for joining us on this very, very fascinating discussion. I think personally, we are at the cusp of really understanding and unlocking health and wellness in the country. And this is going to be a very, very critical piece of understanding how we approach it. Ladies and gentlemen, I bring to you Mr. Tucker and Dr. Lahariya. Thank you so much for being here.